Hello, everyone. Welcome to our webinar today on the what, why, and how of requesting reviews from patients. My name is Melanie Fielder. I am a Senior Marketing Programs Manager here at Reputation, and I'll be your host today. I would like to introduce you to your presenters, Celine Patterson and Clarissa DiCarlo. Celine is Reputation's Healthcare Strategy and Consulting Manager, and Clarissa is a Customer Success Manager here at Reputation. What's unique about these two is they're actually both former clients of Reputation. They have both launched and led online reputation programs at their previous organizations. So they've been in your shoes and they really do understand the challenges of healthcare. With that, Celine, I'll let you take it from here.
Thanks, Melanie. So at Reputation, we're built on the idea that you no longer have control over your brand. Your customers do. And that's because they're giving feedback anywhere and everywhere, whether you ask for it or not. And that's essentially fueling the consumerization of healthcare. So similar to how you shop online for a pair of shoes or choose which restaurant you want to go eat at next, the healthcare consumer journey is mimicking these online experiences more and more. So essentially, patients are shopping for healthcare. So if you listen to our part 1 of this webinar series, you may remember these stats released in our 2021 Healthcare Reputation Report. And this report helped us understand not only what the consumers want, but also how they are choosing a healthcare provider. Our consumer study with YouGov found that the vast majority of healthcare consumers trust online reviews, specifically 80%. In fact, after insurance and location, third-party reviews are the most important factor for consumers when choosing healthcare, with Google being the preferred review site. So in short, reviews are impacting how visible you are on Google and how likely patients are to select you for their care. So Clarissa, do you want to expand on that a little bit?
Sure. So Celine mentioned reviews are an important factor in decision-making, but it's also the second most important factor driving visibility within Google searches. With all the recent changes in Google's search engine algorithm, in many ways, online reputation can be considered the new SEO. User-generated content in the form of online reviews has a profound effect on search relevance because each review is treated as new relevant content, which increases search engine rankings. So as mentioned during our first webinar, if you were able to attend that, responding to reviews is also a form of engagement and further improves in visibility. So make sure to respond. So let's go even deeper. Reputation analyzed the impact of online reviews on search engine visibility and found that 4 key factors have the most impact on where your business ranks in search listings. Review volume, the more reviews, the better. Review timing, current reviews are more credible than olders that may contain outdated information. Review length, longer reviews with detail are considered more trustworthy than short ones. And review sentiment, a higher average star rating contributes to higher ranking in search results. So generating reviews on a regular scheduled basis from patients who are in a position to say something meaningful will pay huge dividends in terms of patient acquisition. And as a bonus, ORM platforms like Reputation will help you leverage all of that customer feedback from reviews to improve experiences with your brand and create happier, more loyal customers. So we just went over a little bit of the why, but Celine's going to dive deeper into how we review requests and then provide some additional reasons on why it's important.
Yeah, so the how is pretty straightforward, right? So patients visit a location or provider in person or via telehealth. The data is securely transferred to Reputation and a request for a review is sent to the patient. And then review volume and ratings on Google and other key sites improve, which leads us to the why. So first, it improves SEO, enhances visibility, and it drives those conversion rates. So recently we pulled averaged data from 5 of our healthcare clients ranging in size to assess the impact that review requesting had on visibility. And we saw an average of 288% increase in listing views and a 291% increase in listing actions 6 months after review requesting was launched. And in addition to visibility, and one of the most common reasons why our clients implement review requesting is because it increases positive online sentiment and ensures feedback is reflective of the quality of care provided. So amongst those same 5 organizations, the average increase in review volume was 507%. That's huge, shifting positive sentiment from 69% to 90%. And lastly, something we're going to expand upon in our next webinar in October is providing actionable insights for real-time service recovery and quality improvement.
Okay, so let's hear from the audience. Our first two poll questions: are you currently requesting online reviews? Yes or no? So who out there listening is actively asking their patients for feedback, whether that be in a more automated, scheduled way via email or text, or perhaps you're just sending out a card with a QR code requesting patients leave a review? This is the first of two poll questions. Are you currently requesting online reviews?
So don't be shy. This is good for us to know because it will help with the rest of our webinar. Okay, I see a couple answers coming in.
Yeah, wow. A lot of people actively requesting online reviews right now.
Oh, it's shifting. Looks like it's shifting. So we're getting a little bit more no's. So we'll give everyone a couple more seconds.
Okay, that's great. That's about 81% of people are actively asking their patients to leave an online review. That's awesome. So for those of you who are not requesting reviews, which it's looking like we're shifting to about 25% not actively requesting reviews, or those who have already implemented a formal review requesting strategy, what was the biggest barrier? Did you have trouble with your legal team allowing email or text review requesting? Was there a lack of organizational support kind of backing your attempt to solicit reviews? What did you find of these four areas as your biggest barrier to review requesting?
And I know a lot of people probably want to say all of the above, but do your best to pick one if possible.
Or maybe none of these were a barrier and there was something different that was kind of hesitation within your organization to review request.
Good point. So don't be shy. We see a couple of answers coming in. Limited budget, staff resources.
Interesting.
Mm-hmm. So we'll give everyone a couple more seconds. We're seeing a shift. Stakeholder support. Good. Okay, a couple more seconds here. We get some technology limitations. Okay, I think we're gonna
Interesting.
end.
Celine, I'm a little surprised that legal.
I'm very surprised.
Concern has not been an issue among this group here, which is great to hear. That it does seem like the majority is either lack of internal stakeholder support or limited budget or staff resources. So, and I think Celine and I can both relate to some of those. So,
absolutely. Absolutely. So, in my previous role at one of the nation's largest healthcare organizations, I knew review requesting was essential, but the idea of launching it was daunting for a lot of the reasons that people selected on the poll just now. So for us, stakeholder alignment, as we saw, was one of the biggest answered options in our recent poll, was getting that stakeholder alignment. So Clarissa, I know you stood up a very similar program in your previous role. What groups did you approach first and how?
Yeah. So again, these are really the 5 groups that you're going to want to kind of get involved in the program early on. I was part of the marketing and communications department in my previous organization. So we were the department, and in my role as a digital marketing manager, that initiated our online reputation program and really worked to get alignment from all the other departments. So when we look at all these groups listed on the screen, I really think it's best to kind of group marketing and communication, patient experience, and operational leadership into its own kind of sub-stakeholder alignment group, because these are really the 3 departments that we tend to see most actively involved in your day-to-day reputation management initiatives, once you've kind of fully rolled out the program. So marketing and communications, not always, but they do tend to be the kind of owner of the program and the initiative. They're typically the ones claiming and managing those review websites, creating the branding templates and wording for your review request, ensuring reviews are being responded to so that you have a high response rate, working on, search engine optimization for those business listings. That's typically the kind of role of the communications and marketing department. In patient experience, They play a vital role in using this feedback to make data-driven changes and organizational improvements. And that's why it's so important to have them as a partner and have them as a partner early on. What good is all this feedback if you're not taking it and using it to drive organizational change? In addition, patient experience can assist with drafting, some of your scripted responses, especially for those negative reviews, or closing the loop on a negative review that requires service recovery. So it's important to have them actively involved and supportive of this initiative. And lastly, as that subgroup, operational leadership is also important to have as a partner because they're the ones closest to the action. They need to have a pulse on that negative feedback so they can address and drive change. They're also your advocate and your spokesperson to clinic staff and hospital staff who need to understand why the organization is requesting this feedback, how to address their patients' negative concerns, and how to get physicians on board who might be feeling shy or worried about requesting reviews. So they can really kind of act as your advocate as well. So bringing these departments together early, creating set expectations and roles for each department so they all kind of understand what role they play, and then keeping very open lines of communications will ensure you're set up for long-term success. So legal and compliance and IT teams, they have a bulk of the workload during the kind of initial consideration and implementation process, but usually aren't involved in kind of the everyday program management. Celine, do you want to go into a few more details about the roles that legal, compliance, and IT departments play?
Sure. So I think we were both shocked that legal was not one of the more selected answers on our previous polls, because often it's the most challenging to get on board for obvious reasons. They want to make sure that how you are communicating with patients is compliant and adheres to various privacy policies. So if you are not doing any review requesting now, make sure that you include your legal team early on to ensure proper permissions and verbiage are in place to solicit reviews. And keep in mind, our healthcare dedicated team at Reputation can help guide you through these conversations and provide you with resources to best educate your internal teams. And for technology, your IS, your IT teams, they play a vital role in setting up how your platform speaks with whatever system you have in place, whether that be an EMR, your EHR, a CRM, you name it. They will help build out any file integrations or API connections that we will speak a little bit more about in a few slides. Making sure that they understand this scope of work early on leads to better success down the road. And again, the team at Reputation will partner with your technology teams on that integration setup so that requests are seamlessly automated. So once you have everyone on board, stakeholder alignment, there are a few best practices to keep in mind when building out your review requesting strategy. So Clarissa, where did you start?
Yeah, one of the first things you're going to want to do is determine what locations and or providers that you want to start review requesting for. And this might depend on your goals, or it should depend on your goals. For example, at my previous organization, we were rapidly growing in the outpatient setting. So it was imperative that we grow patient volume with our new specialists and primary care providers. Therefore, we focused only on our outpatient clinics at first, not the hospitals, and then shifted focus to our outpatient providers. We also see some clients that might segment out a certain percentage of a review request to physicians and a certain percentage of review requests to the facility. So for example, they want to work on building the online reputation of both their physical rooftop locations and their actual providers. So they might send 20% of requests to rooftop business listings and 80% to the provider business listings. So this also brings me to our next best practice. It is okay to not launch a full-scale, full-blown review requesting strategy with all of your locations and providers from the start. In fact, Celine and I both launched in phases. Celine's previous organization took a different approach and focused on their hospitals first. However, in both cases, we phased locations and or providers in and created targeted launch dates for each expansion phase. This allows you to fine-tune your internal process before you roll out to the entire organization and to assure you are aware of resources needed to expand. So I know in the poll question, resources and budget was one of the top barriers. And that's why a phased approach is really good, because you can start with a few And then if you're seeing that you have the resources to handle, you roll in a few more and you roll in a few more. And before you launch full scale, you know whether or not you're going to need additional resources to handle it organizational wide. You're going to have a really good sense of what the resources are required to kind of continue on with your approach. So lastly, you'll want to decide whether to request reviews via email or text. Text message reviews see a much higher response rate than email. We know that. So we do consider this to be best practice. However, email might be preferred depending on your patient demographic mix or the patient data you have, for example. If you aren't maintaining good cell phone data for your patients, then email could be the best way to go. So it really just kind of depends on your organization, but we do see a higher response rate in text message review requesting. So Celine, can you give us some best practices around when to engage patients with a review request?
Yeah, so we get this question all the time. And in my previous role, we did some A/B testing, and we determined that 24 hours post-discharge was the optimal time to send review requests. And this is when we saw the highest open rates, the highest clicks to review sites, et cetera. But keep in mind, this may vary per organization, and all of this can be customized to your own objectives and the touch points that you want to engage with within the patient journey. So whether that be after the initial diagnosis, during ongoing treatment, post-surgery, et cetera. This will also help determine how and when you want to follow up with your patients who have not yet engaged with or actioned on your review request. And in addition, one common concern we hear all the time is that of over-surveying. We can customize the timeframes during which the same patient will not receive another review request to avoid survey fatigue. So whether that be 90 days, 60 days, 30 days, completely customizable depending on your organization. And once you determine this timing, it's important to look at what you actually want to include in your review request. So we have clients that choose to include first names. Some keep it anonymous. If you're sending SMS, you want to make sure that you're gathering those phone numbers. On the flip side, if you're sending emails, you want to gather email addresses. And then depending on your delivery method, determine the name, the email address, et cetera, that the review requests are coming from. And customize your review request templates with logos, wording, location addresses, et cetera. And of course, determine which review sites you want your respondents to leave a review on. So as we briefly spoke about earlier, Google, as we know, is the largest driver of your digital front door. So focus your efforts there and know that you can always expand on them. Maybe your Google review volume is stellar with high ratings, right? Best case scenario, yet your Facebook reviews are poor. So you could direct your request to go to Facebook while you work to boost your reputation there. Again, all of this is customizable at any time. And lastly, you may be wondering about where you're going to pull all of your patient names and their contact information from. Reputation is HIPAA compliant platform. And whether you establish a direct API connection, an automatic SFTP file transfer, or a bulk upload, as mentioned, we do this with clients every day and we help them with every step of the way. So this is a lot to digest at once, and it's only a very high level overview. But for more detail, be sure to schedule a consultation with our healthcare dedicated team. So on that note, we want to show you some of the success stories that we have with a few of our existing clients. The first being how review requesting increased visibility. Clarissa, you want to take us through our first case study?
Yep. So how you measure success really is greatly going to be determined based on the goals that you and your organization have established, right? So for example, this case study with Kootenai Health focuses on their GMB conversions. And when we talk about a conversion from Google My Business, we mean the amount of users who viewed the listing and took action. So for example, they made a phone call or clicked over to your website. As you can see, Kootenai Health saw a direct correlation between review volume, listing views, and actions. It's simple. More reviews, more views, more actions. Conversions are a great way to measure success for patient acquisition goals, but maybe your organization's goals are focused more on improving brand perception, and you want to make sure your online reputation is a true reflection of your patient's experience with the brand. Celine's going to talk about a case study that focuses on overall sentiment.
Yeah, so as mentioned earlier, driving review volume, increasing positive sentiment, and improving star ratings are often the first reason our clients are interested in review requesting. So admittedly, at first, when I was exploring review requesting, it sounded counterintuitive. Why would we ask for more reviews, or specifically more negative reviews? First, if you step back and you think about this more broadly, those who leave reviews organically are typically either very distraught or they're really, really pleased with their experience. Those who receive the experience they expected are less likely to go out of their way to leave online feedback unless prompted to do so. So once prompted, like this case study that we have on the screen, the silent majority begins to leave that feedback. So as seen on the bar graph here, when this client implemented review requesting, their negative review volume stayed the same, but their positive skyrocketed, resulting in a 798% increase in review volume, shifting their positive sentiment from 70% to 96%. And they increased their star rating by 1 whole star. So not only has this client now ensured that their data is statistically significant, they've also ensured that their online feedback is reflective of the care they know they provide. So visibility and sentiment is crucial to patient acquisition, right? But how can a program like this prove value internally, Clarissa?
Yeah, and so every organization wants to know how a program or initiative is impacting your return on your investment. Are you getting a return on your investment? Every marketing department, I've been there, wants to prove that their efforts are contributing to the bottom line. So is launching a full-scale online reputation management program going to increase revenue or decrease costs? This case study shows a direct correlation between review requesting and new patient volumes. In fact, they saw a 697% return on their investment when they compared the cost of the reputation with new patient revenue and cost savings. So essentially, to this end, the more reviews, the more listing views and actions you get, the more patients, and lastly, the more revenue.
Thank you, Celine and Clarissa. That was awesome. As a reminder, this recorded webinar will be available if you'd like to revisit or share it with anyone else. If you enjoyed today's session, we would like to invite you to register for our final installment in the series, How to Turn Online Patient Feedback into Actionable Insights. This webinar will take place on October 14th at 2 p.m. Eastern, and I'll drop the registration link in the chat in just a moment. While I do that, we can move on to Q&A. First one for you. If I don't have the IT, what if I don't have the IT resources to set this up?
So I'll take that one. Setting review integration up is much easier than you think. We talk a lot about file integrations, we talk about API connections, but really all you need to get started is a regular file drop containing your email addresses or phone numbers and the location that the patient visited in a simple CSV format. So it's not as cumbersome as you might think.
Awesome.
Great question.
Next one, how will I manage the influx of review volume and be able to properly manage follow-up once we start soliciting reviews?
Also a great question. I think that Clarissa kind of touched upon this a little bit, but I was very concerned with the review volume being a very small but mighty team in my previous organization. And we do have a dedicated team at Reputation to help you address your review volume. So definitely reach out because we have the ability to respond to reviews on your behalf with pre-approved wording that has been vetted by your legal teams and your teams. So there's a bunch of different options there if you're concerned with review volume influx.
Yeah, and I just want to note that we do have those resources available at Reputation. But one small thing you can do within your organization on this topic is make sure you script out all of those review responses and have them handy so that you can start to respond to those reviews at scale. Our platform allows us to load them in and let you, pick them from a drop down. It makes that very easy. But either way, when you have those scripted responses, especially for negative, you don't have to spend the time to kind of type out a response every time. They're already vetted by your legal department. You should get them vetted by legal, have patient experience, marketing, all look at those responses and have them handy. That way you can just kind of pick one that makes sense and, copy and paste it into your review response just to be able to kind of work on those at scale.
All right. I'm having a hard time convincing other departments in my organization to get on board with the review solicitation program.
Yeah, so that's, as we spoke about earlier, right? That's getting that stakeholder alignment and making sure that you You look at this in a phased approach. I know in my organization, and Clarissa can probably speak to this a little bit differently, in order to get that buy-in and convince our leaders that this was a good idea, we started this with a pilot location. So a location that raised their hand, they said, we're eager to do review requesting. We do want to try it. And when we saw those incredible results, it kind of became a competition internally, right? All of a sudden, other facilities, other leaderships, teams, they got on board more easily because they also wanted to have those results. They also wanted to show up in their search ranking higher, et cetera. So a lot of that is just making sure that you test the waters and then you utilize, again, the reputation healthcare team that we have to help you put together a strategy to address any specific concerns that your team might still have.
Yeah, Celine, that's a really good point. And I also want to say, to make sure that you are approaching each department with what this review requesting provides, what benefits are provided to that specific department. So for example, for marketing, it helps with your SEO and it helps, to drive more conversions on Google business listings, and therefore helps us to get new patients in the door. And that's, a big goal for a marketing department. But for patient experience, they have different goals, right? They're not focused on new patient acquisition. They're focused on improving the patient experience. And so when you're talking to them about this initiative, let them know, review requesting is going to give us a lot of additional feedback, and all of that additional feedback is going to help us determine, where we might have pain points or where we're doing really good. And that can help us drive organization change and improve our patient experience. So you doing review requesting has different benefits for different departments, and even, looking upwards in terms of executive leadership and talking to them in terms of an overall strategy. So I would just, as you're trying to get stakeholder alignment, talk about what benefits to them directly when we're talking about review requesting.
It's a really good point. Good call out.
Have you found a certain time frame for running reviews to be more effective than others? For example, 3 months, 6 months, or longer?
So I think this question is just asking how long to request reviews. Once you launch review requesting, we recommend that you continue with that review requesting, that there's no end date to that initiative. You just continue on with it, and maybe you add to it. So for example, if you start with email review requests, maybe you then elevate to SMS review requests, but do not stop the review requests.
Right, because when we look at some of the factors that come into play into what's kind of impacting patient decision making, and even SEO, are those reviews recent? So if you stop and you don't request reviews for 6 months or 9 months, or you only do it 3 months out of the year, those reviews are going to get stagnant. And we don't want to let that happen.
Exactly.
What strategies do you suggest to reach older patient audience or technology hesitance?
Also a good question. Something that we come across with our, more senior care facilities. We still do review requesting in those areas as well. A lot of times it's more email based on that demographic. We have a couple of different options we can talk through that our reputation team can help you with to strategize, but email is always the first for those communities that we recommend. But again, I hesitate because we think of an older population, a lot of them use that technology too. So we don't want to bucket that or, negate some of the SMS initiatives because of that older demographic.
This is where A/B testing could come into handy, right?
Yeah.
I mean, you can try different options and really see what your demographic, what your community is really responding to.
All right, we have time for 2 more questions. Are there any ways to make it easier for patients to do Google reviews or get over the hurdle of requirement Gmail account to post reviews?
Yeah, so we get this question a lot, and I got it a lot at my previous organization, is you do not need a Gmail account to leave a Google review. That is something that people will say very often. Originally, when you get prompted to go to Google, it will ask you to log into your Gmail account. However, there is a box at the bottom that says just utilize the email address that I already have. And you can go ahead and put in your email address that you use, whether that's, at iCloud or whatever other email addresses there are out there. And then you can move on to leave a Google review. So that is a common misconception.
Do these review requests target a patient's overall care experience, or do they focus on a specific point in the patient care journey?
Also a great question. Kind of both. So you can decide when you want to engage with that patient. So as mentioned earlier, whether that is after their initial visit, when they're discharged maybe from the ER, or if they have to come back for more services or more care, whether that be ongoing care or post-surgery, you can decide where along that patient journey you would like to engage with a review request. All of that's customizable.
Yeah, and I think I saw another question. I know we're running short on time, but I did see another question on any suggestions on how to get a longer review, because we know like the length of the review impacts our SEO, as we were mentioning in one of the earlier slides. So as Celine was just talking, maybe you want to request reviews after, for example, for hospital reviews, after they have their surgery, not before they have their surgery when they're doing any kind of pre-work, because they've had the full experience at this point. And so they have more to share. There's more, touch points that patient has had with us, recent touch points, and they might be more active to share a longer review. So really looking at it, the patient journey, and deciding where's the best time for this patient to request a review that we're going to get, the feedback that we really, really want, that really gives us the information we need to kind of, drive change in the organization.
Awesome. Well, thank you both. And thank you everyone for tuning in today. We're looking forward to seeing you in October.
Thank you.